Dr. Petrie, no matter what diet I try, or no matter what foods that I eat, I just cannot seem to lose any weight, and I can't seem to resolve my chronic digestive problem. Do you think I have leaky gut?
Now, this is a question that I am frequently asked by my patients. Hello, my name is Dr. Brian Petrie, and during this video, I would like to go into the exact mechanisms that can actually cause a leaky gut disorder.
Now, in past videos, this is where I discussed where the leaky gut actually takes place and what a leaky gut looks like on the cellular level, where you have a breakdown in the barrier. Then I discussed the normal digestive processes that have to take place before we could even deal with a leaky gut disorder. And that includes the proper ability to smell your food, which in turn helps to create saliva, digestive juices start to flow, your ability to chew food, your ability to swallow, and then to break down your proteins in the stomach, as well as have a normal gallbladder contraction, as well as pancreatic enzyme release. Now, these are the actual mechanisms that can cause the leaky gut. There are several categories here, and you may have just one that can cause the leaky gut, or you may have one in each of these categories. The first being diet. Now, alcohol has been shown within 3 days of consumption can actually break down the gut barrier. Then you have proteins, large diameter proteins that are not broken down in the stomach and pass into the small intestines. And the most inflammatory ones that are known are within the wheat and gluten family, casein from dairy, as well as any types of processed foods and excessive sugars. Then we have medications. Corticosteroids, antibiotics, and antacids have also been shown to break down the gut barrier. Then we have infections. The H. pylori infection is the most common bacterial infection around the world. You also have bacterial overgrowth, viruses, and yes, even here in the United States, you can have parasites that can cause a leaky gut. Then we have stress. And the reason why stress is such an issue is because it's going to decrease the amount of blood flow that goes to the intestines. And all our healing takes place in our blood. And if we can't get blood to the intestines, then no way that they can heal. The next category is under the hormonal section. And anytime you have decreased levels of any hormones, it's not going to allow the intestinal system to actually repair itself. The next section is neurological, which includes anything such as brain trauma, stroke, neurodegeneration, even whiplash injuries have been known to cause a leaky gut disorder, or will start the mechanism of leaky gut within 6 to 12 hours. And then you have metabolic disorders, and these can be anything like autoimmunity, chronic inflammation that can cause this gut barrier to break down. Now, in our office, we use very specific questionnaires which can help to break down this digestive process to find out where the breakdown may be occurring. These are developed from the Krasny Institute, and they are fairly accurate.
So, as you can see, there's multiple mechanisms that can cause a leaky gut disorder, and there's not a one-size approach fits all for solving a leaky gut disorder. Our goal is to determine exactly what your diagnosis is, and then also determine what the triggers are that are causing it. If we eliminate those triggers, then we can employ the proper strategies to heal the gut. And when the gut heals and the triggers are eliminated, the patient gets better.
So if you're having digestive issues or think you may have a leaky gut disorder, I urge you to contact our office at 774-409-5055 and ask to speak to myself or Amanda, and we can get you the copies of these forms, which will help to determine whether or not there may be a breakdown in your digestive system.